Before Jeff and Lisa begin the presentation on this item, I'd like to provide some background and context about the properties we're discussing this morning. A year ago this week, the San Diego Housing Authority approved this commission's recommendation to authorize the Housing Commission to purchase the two properties. Today, the extended stay hotel properties we acquired in November of 2020 are providing permanent, affordable rental homes for more than 380 people who had been living on the streets or in shelters previously. They also have access to a variety of ongoing supportive services. But I will point out, and as you will hear later, this has been a challenging population. Every one of the residents of these hotels has at least one disabling condition, most more than that, and was among some of the most vulnerable with the highest needs among those experiencing homelessness. Giving someone a key to an apartment does not make the issues they face just automatically go away, even with the supportive services available to them. Some of those we try to serve with permanent supportive housing will not be able to be successful living on their own. It takes time to continue working with the residents of these properties to help them become stable in their homes and get back on their feet. Throughout this process, it should be no surprise to anyone that challenges continue to occur. We will be discussing some of those challenges today and what they mean for next steps in addressing homelessness in San Diego. Some of what we have seen at these properties is consistent with the experience at other permanent supportive housing units throughout the city. But our experience with these properties also reinforces what we have learned over the years since this agency became involved with homelessness programs in 2010. And that is that a variety of housing solutions is necessary to meet each individual's unique needs. One housing solution does not fit everybody. And with that understanding, the Housing Commission and our partners over the years have developed and implemented a continuum of housing programs to address different needs. These range from prevention and diversion to street outreach, to rapid rehousing, to permanent supportive housing. As we have addressed the homelessness crisis in the city, with each success and each accomplishment, the next issue becomes even more challenging. We should not hesitate to celebrate our accomplishments in that we have not seen the dramatic increases in homelessness seen in other West Coast cities over the last few years. However, but at the same time, we should be courageous enough to recognize that what we are left with is the most challenging homeless population, one that requires innovative solutions. Today's presentation is an important step in the discussion about the future. Hold on, I got my phone, home phone, there we go. But at the same time, we should be courageous enough to recognize that what we're left with is the most challenging homeless population, one that requires innovative solutions. Today's presentation is an important step in that discussion about the future. Following the completion of the presentation, we anticipate several local leaders in San Diego who are focused on the homelessness issue to be calling in during the public comment period to share their remarks as well. And now with that, Madam Chair, I will ask Jeff to begin the presentation. Jeff, if you would, please.
Good morning, commissioners. I'm Jeff Davis, Deputy Chief Executive Officer, and with me is Lisa Jones, Executive Vice President of Strategic Initiatives. This morning, we are presenting an update to the board about operations at the two extended stay hotel properties that the Housing Commission purchased last year to create permanent, affordable rental housing for individuals experiencing homelessness. During this update, we will share some of the challenges and lessons learned thus far at these unique properties, and we hope to begin an important dialogue about the strengths and the gaps in the homelessness response system. Specifically, the homelessness response system will need a new type of housing solution for people the current system is not reaching, those who do not engage with services, and those who are unable to live independently. Next slide. The Housing Commission has named the two properties Valley Vista and Kearney Vista Apartments. It's important to note that these units are apartments. Each unit is leased to an individual or family, and neither the Housing Commission nor the service provider have the right to enter the unit without approval and prior notice to the tenant. Combined, these two properties include 332 affordable rental housing units. Today, 389 individuals are residing in these units. Residents have access to a variety of supportive services from experienced service providers. Path San Diego provides services at Valley Vista, and Father Joe's Villages serves the residents of Kearney Vista. Next slide. These properties were previously functioning as high-quality extended stay hotels and were in good condition and ready for move-ins within a couple of weeks of completing the purchase. However, we have taken steps to enhance security and make improvements at the properties while the residents are living there. Both properties have on-site security 24 hours a day, 7 days a week. We're in the process of installing a significant number of additional security cameras at both properties, and we are adding a controlled access gate system at the Kearney Vista property. Additional improvements shown on the slide include complete Wi-Fi service and cable TV service for the residents, and more frequent trash collection. Next slide. So as you know, the Housing Commission has been heavily involved in permanent supportive housing for many, many years now. However, these two properties are unprecedented in their approach to providing permanent housing with supportive services for individuals experiencing homelessness. Traditionally, permanent supportive housing apartments are typically funded by funding sources that serve individuals who are already engaged in supportive service programs. This means that typically persons being referred to permanent supportive housing already have engaged in some supportive services. However, with these two properties, the Housing Commission intentionally applied a lower barrier approach that could serve the most vulnerable homeless as quickly as possible. The initial funding for services at these properties came from the city and the Regional Task Force on Homelessness, including Homeless Emergency Aid Program funding. This allowed us to serve those eligible for permanent supportive housing regardless of whether they had already engaged with the system. That meant that some of the most vulnerable people in the homelessness system were referred to these properties. This approach enabled the Housing Commission to process coordinated entry system referrals much more quickly than we may have otherwise accomplished, and provide housing to some of the most vulnerable individuals, which was especially important amid the COVID-19 pandemic. The next two slides show more detail about the characteristics of the residents at these properties. To qualify to reside at either Valley Vista or Kearney Vista, the head of household for each unit must be homeless and have a disabling condition. 77% of the residents were staying in an emergency shelter before obtaining housing at either property. 14% were living in places not meant for human habitation. 45% reported being homeless for more than 2 years before lease up, and almost half are age 55 and older. The disabilities that qualify residents for permanent supportive housing include mental health disorder, alcohol use disorder, drug use disorder, chronic health condition, HIV/AIDS, developmental disability, and/or a physical disability. Among the residents at both Kearney Vista and Valley Vista, 43% have 3 or more disabling conditions. Another 24% have 2 disabling conditions, and another 20% have 1 disabling condition. Access to supportive services is essential to develop and sustain long-term housing stability for residents. The types of services available for residents at these two properties include mental health services, healthcare services, behavioral healthcare, substance use services, case management, life skill training, education services, and employment assistance, and other enrichment programming focused on providing a sense of community. In addition, staff work with each resident for individualized case management. Case managers meet with high-need residents more frequently, generally at least once a week, but also as often as residents need. Community engagement and enrichment activities are also offered to build trust and connection with the residents. In the interest of time this morning, I will not read through all the community engagement activities available for residents, but as you can see here, they are extensive. Slide 10. The Housing First model is to provide appropriate housing options as quickly as possible with as few requirements or conditions as possible and with access to supportive services as needed. Our experience to date demonstrates that not everyone will be successful in permanent supportive housing. Since individuals have moved into their units at these properties, many have engaged in case management services, participated in community activities, and are stable. However, for some, engaging with case management and services to support them is a large chasm for them to cross. It is clear that we have a need for a variety of housing options to better address some individuals' significant health challenges. Housing First is not a one-size-fits-all approach regarding housing interventions. Experienced providers well-versed in this work are so critical, and we would be remiss here if we did not acknowledge the compassionate and dedicated teams from PATH and Father Joe's Villages that are on site every day, striving to continuously support and encourage residents, not only in their own resiliency, but in building community. That is why having staff who utilize trauma-informed harm reduction approaches to try to engage and interact with residents is so critical. But some residents may not be ready or willing to engage. Some may struggle to maintain wellness under the pressures of a fundamental change in their living situation, the pressures and responsibilities of maintaining their own home, or the pressures of the pandemic. Those who suffer from significant behavioral health, substance use disorder, or co-occurring conditions may continue to struggle with those conditions. The issues do not go away just because they have a home. A certain portion may need a more intensive housing option to be successful and achieve health and wellness. And that includes some who may have initially been placed in permanent supportive housing. The challenges experienced at the Valley Vista and Kearney Vista sites include that a combined total of 12 residents from these properties have passed away since December 2020. The information we have received indicates that some of these deaths were due to accidents off-site, some were natural causes, and some were related to overdose or substance abuse. Each is a tragic loss of an individual that the Housing Commission and Father Joe's or PATH were trying to help to get back on their feet after experiencing homelessness. While tragic and difficult for all involved, situations like these are not rare for vulnerable households experiencing homelessness. Data reflect that the number of residents who have passed away at Kearney Vista and Valley Vista is consistent with other permanent supportive housing throughout the city. Permanent supportive housing units, for which the Housing Commission awarded rental housing vouchers, have served 16,900 individuals from December 10th, 2020 through August 31st, 2021. Deaths represent approximately 2.96% of these 1,690 individuals. The 12 deaths combined at Kearney Vista and Valley Vista that occurred between December 10, 2020 and October 12th, 2021 are 2.84% of the 423 residents these properties have served. This slide shows additional data about deaths among permanent supportive housing residents in the city. For additional context, in the Veteran Affairs Supportive Housing or VASH voucher program, which helps veterans experiencing homelessness obtain rental homes in market rate units scattered throughout the city, 30% of the exits from that program are due to a participant passing away. Similarly, calls for public safety services are comparable across multiple properties. The Kearney Vista site has had 364 calls for service from January through August, or 2.5 calls per unit. The Valley Vista site had 341 calls for service in the same time period, or 1.78 calls per unit. An affordable housing community in downtown East Village, which is not permanent supportive housing, had over 680 calls for service in a similar period, or 2.5 calls per unit. Two additional permanent supportive housing developments experienced about 1.5 calls per unit. Benson Place, a permanent supportive housing development in South San Diego, had 1.51 calls for service per unit. In addition, the Operation Shelter to Home Convention Center security team reported over 2,100 critical incidents during the time it was operating. And that was with shelter managers, residential coordinators, case managers, county public health and behavioral health resources, federally qualified health center staff, emergency services department staff, city lifeguards, 4 separate security teams, and American Medical Response, and the San Diego Police Department and HOT team staff on site. The experiences and challenges in the Kearney Vista and Valley Vista properties are not unique, as we see in the comparable data from the other properties in the city of San Diego. And it's also worth noting that the data can be skewed by a handful of individuals who call for service dozens of times in a short period of time. This is why ongoing efforts by case managers to engage and de-escalate conflict in a trauma-informed way is critical. The Housing Commission, service providers, and property management continue to work hard to engage with residents, address their needs, and provide safe, quality, affordable housing to them and their neighbors. Many of the people we are trying to serve are among the most vulnerable in our community. If we take them from unsheltered homelessness or even a shelter environment to housing from one day to the next, their challenges don't just disappear. Though housing and services do provide important and consistent resources over time to improve the quality of their life. For some, the steep climb to wellness is long and difficult. And for a small portion of those placed into permanent supportive housing, it may be found that other healthcare-focused housing and services are better able to meet their needs. It takes time for all of us to come to terms with life-altering change, even if it is a change for the better. For people who may not have been treated with dignity or who may feel disenfranchised or who are struggling with mental illness, it can take even longer to trust that someone is going to keep showing up for them and connect them to the resources they need to become stable. Next slide.
The majority of people who access permanent supportive housing will be able over time to successfully stabilize, but we must also develop long-term housing options and services that can meet the needs for those who struggle with higher acuity conditions and who need more intensive healthcare interventions, clinical services, and support than the permanent supportive housing model currently provides. This can include support with activities of daily living, such as food preparation or managed medication disbursement. Some individuals also may prefer and do much better in an environment that is less isolating than an independent unit can be. They need programs that provide highly individualized, intensive healthcare resources that meet people where they are and make available housing options that serve them best. Taking that a step further, it is important to ensure that when and if their needs change, the homelessness system has the resources to change with them and ensure a successful transition from one housing opportunity to another, even if that means a more intensive care and housing option, so we mitigate returns to homelessness while providing housing choice. We are seeing a significant number of our unsheltered neighbors with debilitating behavioral health and substance use challenges. They are suffering on the streets, and the tools we have at our disposal aren't reaching them. As we look ahead at the types of housing interventions needed, the impact of substance use across the country is important to acknowledge. According to the Center for Disease Control and Prevention, as of June 2020, 13% of Americans reported starting or increasing substance use as a way of coping with stress or emotions related to COVID-19. Overdoses have also spiked since the onset of the pandemic. A national reporting system called ODMAP shows an 18% increase nationwide in overdoses in the early months of the pandemic compared with those same months in 2019. An American Medical Association brief updated on September 20th, 2021 stated the nation's COVID pandemic made the nation's drug overdose epidemic worse. And one prevailing theme is the fact that the epidemic is now driven by illicit fentanyl. A further AMA report stated that the AMA strongly believes that ending the nation's drug-related overdose and death epidemic, as well as improving care for patients with pain, mental illness, or substance use disorder, requires partnership, collaboration, and commitment to individualized patient care, including a need to focus on harm reduction strategies. These reports and the stark reality they describe clearly show that behavioral and medical health care must be at the forefront in the health and housing solutions we utilize to serve this portion of the homeless population. The San Diego County Board of Supervisors is leaning into this space, directing their health and human services and behavioral health departments to develop a substance use and harm reduction strategy. Dr. Luke Bergman, Director of the county's Behavioral Health Services, reported to the County Board of Supervisors in June that the San Diego region has seen a 200% increase in overdose in the past year. Fentanyl overdoses have increased more than 400%. And an estimated 90% of people experiencing substance use disorder nationwide never seek treatment. Dr. Bergman further stated that we know homelessness exacerbates the harmful effects of drug use and vice versa, and that discussions about developing homelessness solutions need to focus on facts and evidence and address the stigma associated with this issue. He also stated that creating a continuum of behavioral health services and housing options is necessary. According to the National Alliance to End Homelessness, the Housing First model is the polar opposite of a one-size-fits-all approach. For some people, group home programs with more structure and support provide better opportunities to thrive and engage in community. It is also worth noting that San Diego's homeless population is aging. This year, the Regional Task Force on Homelessness, or RTFH, established an ad hoc committee on older adults experiencing homelessness. It is well documented that rigors of homelessness are also known to prematurely age people as well, often causing older adults to suffer from even more acute health conditions. So for others, more affordable supported living environments that help address basic activities of daily living, like bathing, dressing, and medication management, are needed so people can live in dignity and health. Homelessness poses complex challenges for which simple or one-size-fits-all solutions are just not going to be sufficient. The homelessness system needs a continuum of shelter and housing options beyond what is readily available today to meet the diverse needs of individuals and families experiencing homelessness. Before the pandemic, the San Diego Housing Commission had experienced prior success converting hotel properties into permanent affordable rental housing, either in collaboration with developers or through direct acquisitions. On this side, you can see examples such as the Housing Commission's award-winning rehabilitation of the historic Hotel Churchill and our purchases of West Park Inn and Quality Inn. In addition, we collaborated with Affirmed Housing on Zephyr Apartments and with Father Joe's Villages on Benson Place. The Housing Commission awarded loans and housing vouchers to support both of those developments. As a leader in collaborative efforts to address homelessness, the Housing Commission has established a continuum of collaborative programs to meet housing needs in recent years. As Rick noted in his introductory remarks, these include prevention, diversion, street outreach, rapid rehousing, and permanent supportive housing, all of which are part of the Housing Commission's Homelessness Action Plan, Housing First San Diego. This action plan has created close to 9,900 housing solutions in less than 7 years for individuals and families experiencing homelessness or at risk of homelessness. The permanent supportive housing units at Valley Vista and Kearney Vista, as well as the units at the other hotel conversions I mentioned a moment ago, are among these housing solutions. More than 500 additional housing units are also approved and pending completion. As changes occur and different needs become apparent, like the issues discussed today, the Housing Commission will continue to work with the city, the county, the Regional Task Force on Homelessness, and service providers to advance new housing solutions. This slide provides the sources for the information discussed regarding the issues for addressing homelessness as we plan for what is next. The Housing Commission has operated or managed similar permanent supportive housing properties for several years. As the data presented today show, the experience with the population at these properties has been consistent with what we see at other similar properties. However, we know that this type of housing is not the answer for everyone. Additional housing options need to be created to address the unique needs of individuals experiencing homelessness. It is essential for the homelessness response system to develop new housing solutions that serve the people the current system is not reaching, those who do not engage with services or are unable to live independently. Programs that provide more individualized intensive healthcare and meet individuals where they are may better serve some individuals and may be a less isolating option that they prefer over living in a unit on their own. The system also needs to provide options to mitigate returns to homelessness while continuing to provide housing choice. These interventions need to provide the resources to change as the individual's needs change. The current continuum of housing options developed over time effectively serves many of those who experienced homelessness. However, permanent supportive housing cannot be the end of that continuum. Housing First is not one size fits all. The work ahead will need to be focused on the needs of the individuals the system serves, being person-centered, and also address the challenges we know exist in the population experiencing homelessness. That concludes our presentation. The CEO of the Regional Task Force on Homelessness and other organizations involved with and interested in addressing homelessness plan to provide their comments during the public comment period on this item, and Ms. Kohler is online now. After the public comment period, we're available for questions and further discussion. Thank you.
We'll go ahead and move into commissioner comments or questions. Commissioners, I see Commissioner Mitchell is off mute. Take it away.
First of all, I want to open this up by saying I appreciate this, the discussion that we're having today. And it is an important discussion. As I have often said, homelessness is a horrific problem that the entire nation deals with, but in the state of California in particular, where several factors lead to homelessness, we have to be better in the state of California. I commend the staff for the report, and I commend the staff for the efforts that they're making as homelessness is becoming a full focus for the Housing Commission over the last few years. The number one thing, Madam Chair, is compassion. It's humanity. It is empathy for those who are struggling with homelessness, whether it's because of mental health conditions or other chronic conditions, or it's because the cost of living in San Diego has been discussed and we've lamented it for years, yet it continues to spiral out of control and become a problem. And so what we now are faced with is a multifaceted solution or plan that allows us to provide the most compassion and care for those struggling with homelessness as possible. I will be the first to admit that the hotel solution, when first presented, seemed great. I still believe that the hotels are an important part of our overall multifaceted plan. And we have a lot to learn about managing these difficult populations within the hotels. And I say difficult because you're putting several different people together that all have different needs. And Lisa Jones and I had a conversation about this, and so did Mr. Gentry and I, and I will agree. It's not easy. And what we will learn from this first move into the hotel space is we'll learn about the need for proper critiques and assessments. And I have all the faith in the world that with the guidance and help of Tamara Kohler, that we will get this right before anybody else. But that being said, I think that the other components that are going to be important in this equation are, the staffing levels. And, this is a conversation that we will have with the county. And the county, I give them credit. Chairman Fletcher and I've had a number of conversations about the fact that, Jeff Davis made a couple of comments in his report. And we can't forget the fact that 77% of the people in the hotels were living in emergency shelters, 77%. And now they're in, a structure that will provide them comfort and safety. 45% of them had been living homeless for 2 years or more. And what I'd say is that the county has a role to play in partnership with us, as do all the other agencies. It was good to hear John Brady on. They have insight that we have to listen to, but staffing. If we're going to put people in hotels, let's make sure we have the right staffing structure in place to truly protect them and care for them and guide them. And as Lisa Jones mentioned in her comments, sometimes it takes 2 years to get them stable, and that's fine as long as you have the right staffing levels. And this is a regional approach. Madam Chair, you remember when we were buying the hotels, there were other cities looking at the opportunity to take state money and create housing solutions for the homeless. And unfortunately, we were the lone city that really the commission stepped up, and it's going to take the cooperation of others. We are a region of 18 cities and a county, and this has to be a regional approach to addressing this. And last but not least, on the deaths, I will admit to the Madam Chair that the number bothered me because it was staggering. But I also understand after talking to Lisa and Mr. Gentry and Tamara, that this is a difficult population. We are going to see these matters happen. And as long as we are staffing and operating the hotels in the highest capacity possible and ensuring that yes, deaths will happen, but we're preventing deaths where we can. then that's all we can ask, and that's all I would ask. And so, I know that this discussion has been toxic at times. Unfortunate incidents will occur, and I will say this for the public listening. Again, this isn't just about compassion from the Housing Commission, commissioners, and our staff, or the compassion from the providers. It's from the public as well, because I know that a lot of times when we talk about how to create solutions, the public will sometimes say, well, that's great, create a solution, but not here. We are going to need now more than ever partners, not protesters. And that's something that everybody always remember. We're going to need more partners, less protesters. And, the mayor recently went through a horrible incident because he's trying to do his job and he's trying to show compassion. And what he is dealing with is not always easy, but we all have to be in this together. So to Mr. Gentry and the staff, I appreciate the conversation. We have a ways to go to get this right. But I think we will get it right as long as we're focused on, again, providing the best level of care possible, guided by the staffing and the experts. So thank you, Madam Chair.
Thank you, Commissioner Mitchell. Any other commissioner comments? Commissioner Hester, Commissioner Plumpner, you are off mute. I'll go ahead and hand it to you.
Thank you. Yeah, I want to start by thanking everybody that's working on this, from the agency staff to the providers. And, if there's a lot of, I think, open questions about where to go, what we're doing right, what we need to improve upon. But I think one thing that is very clear here is that this is very difficult work. It's challenging, and people are working incredibly hard to find solutions. And so I don't want to move on without acknowledging that and thanking everybody that's doing that. I think that we do need to address some of the information that was in Voice of San Diego. And I want to kind of start by thanking Lisa for I'm going to read part of your quote here, not to put you on the spot, but let's not be afraid to admit that this isn't going to be easy, but it's the right work to do. And I couldn't agree more. And I would go a step further and say that, I think we need to lean into being open and transparent about what the challenges are. And part of that context is, I think we should reassure everybody working in this space that, we, the commissioners, the city council, everybody kind of involved here, I don't think a single one of us would get some bad news and conclude that we should pull back from any of these programs. I think that the conclusion that we all reach when we read about the struggles, the challenges, what might not be working ideally, is that we need to go further. And specifically, I think the issues around the staffing levels, brought up again. I don't know that any of us is qualified to say exactly what the right staffing levels are, but from what we're hearing from some of the residents and others in the field, it seems like we need to look at adjusting the staffing levels, because we are dealing with a population that does have very significant challenges. And the easy answer here is to say that whatever we are providing in this context is better than where they would be if they were on the street. But I don't think that we can kind of set that as the standard. I think we need to set the standard as making this a solution. This has been sold to everybody, the public. I mean, we're all in agreement that permanent supportive housing as an umbrella for this wide variety of solutions is the path forward for dealing with homelessness. And I think at this point, just about everybody is aware of kind of the historical context here. We're dealing with people with challenges that in the 20th century were dealt with in some horrific institutional ways. And when those were taken off the table, we didn't really put anything on the table to deal with this. And so we are coming up with solutions as we go here. But what I don't want to have happen is, the fact that things going wrong leads to either pulling back on these programs, or that we don't hear about things that are going wrong because of fear of pulling back. We're not going to pull back. None of us will support that. And so I do have a few questions. And I'll put kind of all three of them out there. One, if there's any comment on the staffing ratios, and specifically, one thing that I keep thinking is that we have done a lot to try to improve the pipeline of people qualified to do this work. I worry that, and this is not something necessarily within our control, at least fully, I worry that in the current labor market, that the pay scale for some of this work is just too low. This is clearly very difficult work, and if we're having trouble, it's got to have something to do with how much we're compensating here. So I'm curious if staff has thoughts on that. Secondly, I think the full context around the deaths is very helpful, and we are very aware that there are health issues, that this is going to be a reality. I think that was also pointed out from kind of a different angle, and that was San Diego story about other research that's been done on this, that high levels of fatalities kind of comes with the territory when you're dealing with people that have chronic conditions. But there does seem to be something kind of peculiar about the window in which they appear to be concentrated at Kearney Vista. And so I guess my question on that would just be, are we saying that's just kind of a coincidental fluke? Was there any change in service levels or anything that would explain why that could have happened? And then, lastly, I want to address specifically one of the comments by a resident about their inability to get AA and NA meetings. And, I understand that we're in a pandemic, but also when I was looking at the list of enrichment activities, which is great to see, I did kind of wonder what would be so different about those meetings as compared to some of these other activities. And so I don't know who wants to take all those questions. I'm sorry to give them to you all at once, but feel free. Yeah.
Let me be the broker if I could on this. Let's deal with them in order. Staffing levels first. I do have a couple of comments, but Lisa, would you address that first, and then I'll come along behind you.
Absolutely. And, I think Commissioner Klumper, I just want to thank you for commenting on the challenge in our industry around staffing. That should not go under discussed. It's not just the commission or the providers that are feeling it. I know in our conversations with county, they are feeling it as they are trying to ramp up harm reduction strategies and crisis response. So they're feeling those challenges as well. It's across our region and frankly, across our country. As far as the staffing levels at the two properties, although obviously with vacancies or potentially someone being out sick, and certainly COVID, if anybody has a sniffle, you have to be off site. That's something that's going to fluctuate from day to day. The staffing ratios are averages, and it takes into account specifically case management to persons served. It doesn't take into account other staff that also provide resources, whether it's peer support specialists, substance use disorder specialists, employment specialists, activity coordinators, who also provide different levels of light touch case management, and sometimes are the ones that focus on those lighter touch people, because the higher touch, higher acuity need more concentration and focus from case managers. That's not trying to sort of justify the ratios. That's the way it's generally put together and works.
Yes. And sorry, if we could just pause there for a second, because I want to get some clarity on this. So, but presumably those same things would be true when we're comparing to other PSH in San Diego, and then also the other studies that had other ratios suggested, or are we in some ways comparing apples to oranges? I'm just curious whether it's apples to oranges or apples to apples.
Yeah, so it's probably both, right? So yes, along other PSH in San Diego, it will be similar. There are some programs that have what's called ACT level services housing, and that's very high acuity, 1 to 10. ACT level is a great resource, but it's incredibly hard for people to qualify for it, even if at an observational level, the clinician sees that's what the need is, because you actually have to track and memorialize their institutional incidents that occur. It's very hard for clinicians to track that. Unfortunately, what that means sometimes is that someone is in need of that level of service, but it can't be justified against the funding source. So when you get to a full service partnership funding source, which is sort of the average funding source for a lot of behavioral health resources, you're looking at somewhere between 1 to 20 to 1 to 30, depending on acuity. And that's in conversations with the county. I do want to note that we, in regard to some of your questions about substance use disorder, like Alcohol Anonymous and Narcotics Anonymous, we actually do have Ruth Ruland from Father Joe's Villages on Zoom with us today that can respond to some of those questions. And we have Hanan Scrapper from PATH San Diego on as well.
Let me, if I could, point out that part of it is staffing ratios, but part of it is the generic type of service being offered too, which can vary tremendously, which affects number and quality and depth of staffing. For instance, when we got started with our Housing First San Diego set of programs in November of 2014, we had 5 programs. Lisa, how many do we have now?
Oh my goodness, over a dozen probably at this point.
So we've expanded from 5. I'm recalling it's up around 20. What happens too is that when you analyze a problem, you'll see that it's not a more people, but it's changing the type of program. So what we're seeing here is that we may be on the edge of the need for an additional type of program to serve these needs. You heard one of the comments made earlier that this is a residential housing where the sanctity of each person's dwelling unit is supreme, and they have the right to allow and bar people coming in, except for good reason. But if you have people who have the need for greater intervention, perhaps that's not the appropriate model. So what we're talking about here is that, once again, this agency is on the cutting edge of what may be a different set and type of programs from what we've done before. And as you've heard both Lisa and Tamara and Jeff all say, that probably 90–95% of the folks living here, this has been appropriate housing. For a number, maybe there's another program we need to help get designed. And it may or may not be something that fits within our portfolio. It may be something we assist in or don't do directly. We don't know that yet. I'll point out too that in conversation with national leaders, this is a conversation that is not really held anywhere else in the country, just beginning to happen. So I think once again, because of our involvement in this set of programs over the last 6, 7, 8 years, we're in a position where we're on the cutting edge talking about what may be some common conversations a year or 2 from now. Just saying, so staffing levels are certainly a critical factor, but it may be the type of program involved too, the design of the program that is implied rather than just more people doing the same thing.
I also, if you don't mind, I'd like to call out that this is a really opportune time to be having this conversation, as challenging a conversation as it is to have. We talk a lot about the home key money that's coming down from the state, about $3.5 billion, but there is another set of funding coming down, same amount, $3.5 billion. It's not quite as far down into being announced yet, but it's coming, which is related to behavioral health care resources and mental health care resources, which gives the opportunity to fund other programs like board and care, group home opportunities, and other things that might be a good either long-term or interim intervention for folks. So there's an opportunity really now to really bookend PSH with that other level of supports where people might be more successful. And that's coming as well. So I think it's important as we're having this conversation to know that there's opportunities for solutions out there. You think about the harm reduction strategies that the city and the commission are working with the county on, the shelter that you approved last month as a board, and the safe haven sites that we're looking for now as a partnership. There's opportunities to better fill some of these gaps, and there's funding that's coming that will be available too.
Ms. Bruin, I wanted to make sure that you have an opportunity to respond as well, if you'd like to make any comment.
Yeah, Thank you. There's an irony to this meeting today in that it really is a victory. And I want to say thank you as a result of that to Tamara and Lisa, because I know both of you have worked very hard. Heretofore, the population that are being served at Kearney Vista and that PATH is working with, we wouldn't have had them come into housing. The system didn't function in a way where they would have been brought into. This population has such complexity of issues that they wouldn't be able to initiate necessarily entering into permanent supportive housing. Our TFH and the housing providers had to go to them to get this to happen. And so that we are facing the number of issues that have been delineated thus far this morning, it's such a tremendous success that we can even talk about it. And it's traumatic whenever somebody dies in permanent supportive housing. You know, we put literally our heads on the table. It just is, it's overwhelming. But they died in their housing. They didn't die on the streets. And that, oh my gosh, that's good that it happens that way. So I just have to call out Tamara and Lisa for the excellent work that has been undertaken. We are opening St. Teresa very soon, and we're having to approach it in a very different way, because we know that now the people who really, 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 really need it are going to get into housing, and we've got to be ready for them. And that is one of the reasons that we chose not to apply to continue to operate Kearney Vista, because we know we've got to be ready. It's a different kind of challenge, and we can't complain about it because it's the right challenge for us to face. So then just let me address quickly the AA and NA. A lot of those kinds of services went to online. And so to get that going in the environment of COVID really has been a challenge. We've got it in other locations, so it is absolutely possible, but things have to align a little bit differently for it to happen more readily. So it will happen.
If I could, Madam Chair, Ruth, thank you so much for resetting our perspective here. We see this too, staff do, as a success, but bordering on the next level of programs, which is causing us some challenges and some consternation. And it's something we think will help this community to find that next level of care that's going to be needed. And there are two other questions that Mr. Kluntner had I want to focus on, the Madam Chair, if I could. One is, I'm going to ask Lisa again to talk, sorry, and I'll close it, but that is the deaths, what appears to be maybe a concentration in deaths. Have you seen anything at all from the authorities that would lead you to believe, other than the fact that it was a coincidental grouping of numbers that are normal and given this cohort of this population?
Well, I haven't seen anything from the authorities, so yeah, I'm curious. I hope Lisa can answer that.
To be frank, we have not. The information that we get when a welfare check is done, or that the providers get when a welfare check is done, is that the AMR will tell them, we see no evidence of foul play, but they are not making that determination. And I actually think Voice of San Diego called out that a lot of the reports and assessment on the cause of death are still pending on several of the cases. So we don't get that information either, and really don't get it unless we make a public records request, or unless a family member or other neighbor shares with us. There's been nothing to indicate that there was something specific going on. We haven't heard that from the providers, but I don't want to make an assumption when we don't have all the information yet.
But so just to, I think my core question here, and I mean, I understand that we're operating with incomplete information. I think my core question is, at this time, do we have any reason to believe that there was a change in the services that were being provided that would correspond to that, or no?
No, we actually monitor staffing levels and work closely with the providers on that because of the population that we're trying to serve here. So there was no report that indicated that anything significant had changed. Fortunately, because both PATH and Father Joe's are big agencies, when they do have vacancies or absences, they can often pull overtime from other properties just to make sure that resources are on site.
Thank you.
And I believe, Madam Chair, that the question with respect to the AA meetings, et cetera, Ruth addressed very, very well.
And then just to be clear on that, the answer, and this is fine. I mean, the answer is regardless of kind of what was happening months ago, is that those meetings are and or will be allowed to take place going forward.
Correct. Well, we won't be at Kearney Vista, but there should be no barriers to that. We have them. I think PATH has them on other properties. It's just the circumstance related to this because of COVID.
Okay, I'm going to give Commissioner Hester an opportunity to speak if she'd like to take it, but okay.
Absolutely, absolutely. I want to thank everyone who spoke out today. I'm thinking about what the relative of the person living in one of the properties said, and really want to hang my concerns around the services or lack of services the residents are receiving, which then goes to what Mr. Brady said. I'm sorry, Mr. Brady said about, you know, although housing first is the highest form of solution for homelessness, we need to invest in supportive services. So I really want to, again, focus on the conversation around, if we're going to take on, you know, our expertise is housing, our expertise is not behavioral health, right? But it seems to be crossing over because we are servicing a particular population that is in need around that. So I think I see some gem around what Lisa said about some funding that we could utilize to increase you know, some of these services, funding for these services, because let me tell you, $15 an hour is not going to feed a family. And then the amount of stress the staffers who are working in this industry, we're going to have that problem to be ongoing. So to me, it's an overhaul and, you know, further commitment of our resources here. So that's, I mean, that's sort of what's hanging on my head. And I'm really, although I'm very concerned, though, I have to say I'm hopeful because I feel like I work with some pretty committed people in the Housing Commission, right? So that, at least I believe that we're looking at all possible solutions here.
Madam Chair, let me initially respond to that, and Lisa, I'll ask you to fill in the gaps that I'm sure I'll miss. But Johanna, you hit the nub of the big issue, the big question to me, is what is our job here? What is our role as a Housing Commission? What is it we do? Where should we focus our expertise and our resources, and perhaps expand partnership beyond that? And we are housers. We're not mental health or behavioral health experts. We don't pretend to be. In every one of these, as we've more and more evolved into the homelessness arena since 2014, we have developed partnerships and relationships to help merge the two together. And we've had, on the staff level, at least, a great relationship with the county, particularly through Dr. Piedad Garcia, going all the way back. That's worked very well. Here, we're entering into an agreement, into an arena where there may be some redefinition of the agreement of where one set of services start and another stop, and how they fit together. I've had conversation with Lead Supervisor Nathan Fletcher about that just this week. And the county, and as Lisa indicated from Dr. Bergman's comments earlier, the county is engaged in addressing this very same set of issues at this point. So I'm not sure I know the answer to your question right now, but I think we will be able to define it, where that relationship connects and who does what, when, where, and how you pay for it, which is the biggies on any sort of a program or business operations. But that's what we're moving to define, and I don't have an exact answer for you right now, but I'm sure we will over time.
Thanks, Rick. And Commissioner Hester, to go back to your point, I think talking about compensation is critical. The other thing around compensation is making sure that all of the different major funding agencies, the city, the commission, the county, RTFH, when they provide funding, are aligned in what those ranges are, right? So when you have a situation where one project is being funded at, say, $20 an hour for a particular position, and another project is being funded at 25, that then creates an inequity within that service provider's overall employment. So they end up getting pushed down to that lower rate, because otherwise it's an inequity within the same position. So we actually have been having a lot of conversations around this work, because we need to align this funding. I think we've done a good job over the last couple of years in moving the needle in a lot of ways. There's a few legacy programs that we still need to elevate and push up. I will say that you're right on in around $17 to $18 an hour for frontline staff, like an outreach worker or a residential coordinator. And so these are staff that may not be have a lot of background training. They might have gone through our peer program actually, and they might have a lot of compassion in the work, but without that higher level skill. Higher level skills run anywhere between $22 to $37 an hour, depending on the level of the position, depending on their clinical background. But then when you have situations where the county, bless them, is bringing on 100 new mobile crisis response team staff, or bringing on 27 new psychiatric emergency response team staff, those particular positions, because they're so crisis oriented, paid sometimes $20,000 more than any other similar position. And though we need them, and we're thrilled that the county is working in this direction, it also pulls from our workforce. Huge challenges that need to be addressed. And the collaboration and conversations that we're having are going to be critical to make sure that everybody's right sizing in the same way.
I was just gonna say, even at $20 an hour, that's $41,600 a year. That doesn't pay for that workers' families, right? Or housing even. So
not with our rental housing market, no.
Right. So, I mean, I just, I want to uplift that we can't, we have to fund positions that also isn't going to tip over themselves into homelessness because of the condition that the state and the country is in, even on housing. But, again, I heard some gems in some of your talks, Lisa. So I want to thank you for that. These fundings that are possibly on the way, but we are not, behavioral health experts. We are the housing experts here. So let's get some housing and partners in with folks who can assist the residents. I'm concerned about the residents that are not, as the woman whose brother lives in the property. And also the conditions of the housing that she uplifted, right? The mold and other health conditions. I thought we got cleared on the inspection, but I'm curious about that, and moving forward, how we're really assessing the property, if it's healthy or not. So, thank you.
And we'll follow up on that for sure in that particular unit, ma'am.
Okay, I'm gonna just.
Madam Chair, can I just make one closing comment about this? I will say that I think that we've had this conversation about the staffing issue, and I brought up in my comments, obviously. With the money coming in, Lisa, one of these, and I've said, you've heard me say this before, partnership opportunities. I've mentioned we should be sitting down with Sandag regularly. The workforce partnership is, we have to get this focus on creating this group of individuals who are essential right now. And I don't know, aside from us having this conversation with the county, is the workforce partnership involved in coming up with ideas on how we use the money to train people faster, Madam Chair, I've said to people before, working with the Downtown Partnership to try and give an increased level of outreach capacity to clean and serve, so that the people who are on the streets, that we have some trained professionals there. I just hope that we're going to be creative, because travel nurses in Los Angeles right now are making $7,260 a week because the industry is getting crushed by COVID. So this isn't an overnight. There's no overnight solution, but we have to talk about what we're going to pay for salary. But more importantly, it comes down to not just talking about salary. We have to actually find a pool of people and start getting them ready and training them to help us immediately and building a pipeline. So there's a lot of conversation about talking about it. We have to start doing, and I just hope that there are collaborative conversations going on outside of us in the county with people who can help us create this focus at the community college level at all and start producing that pool. And I know we're doing some of that now. We need to supersize it.
Yeah, I echo most of those comments. Lisa took the initiative to get that program started with City College, and hopefully we start seeing those dividends. But I'm troubled by what we're going to continue to deal with as far as workforce goes. Every industry is struggling, but if you are facing a job with, high trauma individuals, high acuity, safety concerns, and the added pressure of a, high profile role right now, recruiting is going to be very hard, especially since I'm fairly certain that our neighboring jurisdictions pay better. So I can appreciate the inequity. If we raise it here, then we're putting some pressure over here. I'd like to see what our differentials are with LA, Riverside, Orange County, and maybe we can right size that way. The San Diego Housing Commission has been very successful at finding money. I think it's time we find money to make sure that we keep our staff, especially the ones who have done the work and are building those relationships. I would challenge staff to think through that and see what we can come back with, and maybe have to revisit from the budget perspective as well. My comments are, I was getting the sense that this conversation was a trial for permanent supportive housing. It's absolutely not. And I think that the other commissioners did a good job of specifying that. We're all supportive of permanent supportive housing and having these options on the table. The hotels are a net positive. It's a learning curve though. And so I think some of the questions that I have are, we have such a visible pool of homeless folks in San Diego, folks who need support. When we did our intake, it sounds like we prioritized folks who were not attached to services. We were prioritizing folks who had a steeper climb in a shorter period of time in a newer sort of program. So we set ourselves up for challenges, not that that's wrong, but what are the lessons learned for, as you guys were mentioning, the additional money for potential other properties? I would like to approach new properties, new opportunities with a clear lessons learned, things we don't need to do again. What can you help me understand some of the intake and what we might have learned from that?
I'll start that, and then Lisa and Jeff, I'll ask you to weigh in too. We have, Jeff, do we have the direct state guidelines in yet on how the money's to be deployed on, so that we can set up some judging when the developers come back in with properties?
Yes, we do. The criteria is just a week or two away from being formalized for the development community.
What we did was to reach out to the community this summer, let them know it's coming. And this time, because we have time, which we did not have last year, the Housing Commission is taking a two-pronged approach. Number one, we have two brokers who are new lined up to bring us property. And we also have a number of other developers that we have told will bring us their properties too. We're going to do a competitive evaluation with no leaning either way. But we needed to wait till we got the state regs in to make sure we could put out the criteria one time. And Jeff tells me that's being completed as we speak. I think that the key here is what we're going to be able to do with the money that we've got. And I think clearly, as Ruth put it so eloquently, this is the success in in making our jobs tougher. And as we have moved to deal with what I think is a pretty successful approach to dealing with some of the needs for rapid rehousing and permanent supportive housing with folks who have the services in the past, we've got some basic questions to ask and answer about: are we going to require services coming in, and or will the owner on the outside, or us if we're the owner, be able to show how we're going to deal with folks coming in without services? I will remind the board that a year ago, when we were in this situation, the city made absolute commitments that every one of those individuals housed in the convention center would have a place to live if they wanted it. And there was little other screening added in there. So this was a decision not made by the Housing Commission in isolation, but by the total city leadership. And in total, I think it's worked. But going forward, we need to figure out exactly what we require the developers to show that they can handle going forward. As Johanna put it so well, paying people a decent wage to provide the services these folks need. Lisa, anything you would add to that, or Jeff?
Yeah, so I think, and to both, Ruth said it really well, like the success is that we're getting to those hardest to serve, right? And oftentimes, for one reason or another, they get screened out of permanent supportive housing, and Rick's just, emphasized that. I think what we look at as we go forward is how we provide balanced communities with high acuity, moderate acuity, and high acuity. So you don't have as many high acuity folks in the same place. I think that was quoted in the Voice of San Diego article, and I think we all agree this was the right thing to do at the right time for a lot of really good reasons. And in fact, because of the pandemic, we saw people engaging in shelter that normally don't. It was really a city closing down around them that pushed them into service, and it created an opportunity. It's also creating a challenge and pushing us to have a dialogue that's going to be really important if we're going to have success in meeting the needs of some of those that are struggling and the most vulnerable on our streets right now. But doing it in a way where we, within permanent supportive housing, have a continuum of need so that we don't get overwhelmed by the few. And also this other funding that's coming down from the state, really more for behavioral health and higher level systems of care.
Yeah,
whether it's safe haven or board and care or adult independent living care, is going to be a place to make sure that if those folks can't get into PSH because they don't have the cognitive ability to sign a lease, people sign a lease here, or they fail out because it's just too tough for them, that they never end up in the homeless system again, that we have another resource so people don't fall off that cliff, right? We bridge that gap. And that's going to be the opportunity. But as far as we look at the home key properties, it's finding a balance of acuity and then making sure that we are working with our county and our other partners to stand up some of those other gap resources that need to be there.
Thank you. That's a reassuring answer. I've got concerns with the fact that permanent supportive housing is not a new concept for us. It's not a new concept for many of the partners that were kind enough to call in and help illuminate this conversation. And yet this conversation feels a little bit newer in the public realm, which we've kind of alluded to. But I agree with what Vice Chair Klubner was saying too about aggressively leaning in to the transparency here, because I think so many folks look out on the street. I passed a woman having a very, very traumatic moment on the street last week. And, folks are watching all of this. And when we tell them that we're spending a certain amount of money to put 400 people into housing, and yet these things do not align for the public sentiment is necessary. So I want us to really throw it all out there, and the good, bad, and the ugly, just to do that. We talked about staffing, we talked about funding, more funding coming down. I'm curious about how we are engaging with the county to ensure that the lessons learned thus far show up in what the county does for the service part going forward. I would hate for us to say, okay, this population is more challenging than we thought, or this segment needs XYZ, but let's let the county find out the hard way, right? How are we making sure that our properties are going to be well taken care of by the services that they provide?
Lisa, would you start that on talking about maybe your conversation with Dr. Bergman?
Happy to. Yes. Sorry, I got a little sun there. So just to talk about the process that we've gone through over the last year, it was a team of county staff and housing commission staff over a period of time that developed the scope of work that was released for the joint RFP that we released. As that scope of work has been released and now they're in negotiations with the providers, our staff still continue to communicate with them. And then I work very closely with Dr. Bergman, the Director of County Behavioral Health, and his Deputy Director, Cecily Thornton Stearns. We talk weekly around understanding what the population needs, both in the hotels and the environments that we're talking about to bring services to, but also in what's next, right? And that's really critically important. And that's where the conversation, the partnership between the city of San Diego, the county, and the Housing Commission around harm reduction strategies is, I think, to Commissioner Klumpner's point, really leaning into that space, right? It's not something that we should lean into on our own. We need the experts to come and do that with us. And there's a source that's noted on one of the last slides of the PowerPoint that is a link to Dr. Bergman's presentation on June 8th. I highly recommend that our community stakeholders and anybody who hasn't seen it yet, watch it. It really shows where the county is going in this direction, and it creates an opportunity for some really strong partnership to solve for exactly some of the things you're talking about.
Do you know, could you speak to whether or not the staffing levels are going to, we keep harping on staffing, and I'm aware of the fact that we are handing staffing over soon. Can you speak to whether or not they're going to at least maintain current staffing as we've set up, or possibly maybe going further and ramping up staffing?
My understanding is they're at least maintaining current staffing, but the opportunity that the new funding source provides is Medi-Cal reimbursement. And that Medi-Cal reimbursement is on top of the 5.4 or adjacent to the 5.4 million that the county set aside in realignment funds. So we have the 5.4 million as that baseline, but then the Medi-Cal billing and reimbursement allows additional funding to be pulled together to really strengthen resources. So we really see it as an opportunity, and in conversations with Cecily Thornton Stearns, they're definitely seeing those first 3 months and that transition period between providers. Obviously, PATH is looking like, although it's not final yet, we're still waiting to see what the finals are. The county hasn't released all of that information, but that transition period is a time of assessment, reviewing case management notes, working with caseworkers, making sure that they understand what the needs of the population are, and then coming in and doing that Medi-Cal reimbursement assessment, which gives the opportunity for additional funds and resources.
Okay, thank you. Yeah, I know that the Medi-Cal reimbursement piece is really attractive. I worry that it can be restrictive. Once upon a time, my experience with Medi-Cal reimbursement, hopefully that's changed. But
I think, well, that's where the 5.4 million really gives us that flexibility too. So it's a great combination or layering of funds. But yes, that there can be challenges in that as well.
But Madam Chair, what you're getting at is going to be one of our major stresses going forward. And that is, there's not a well-defined, well-structured, uniform program with funding attached to it to go after do this stuff with. It's a matter of us pulling some stuff together, almost like a developer does to finance a property, where it's more, it's just a lot of vectors involved at the same time, with each of them affecting the other. So to tell you exactly how we're going to put that together right now, not possible. But to tell you that we're going to pull these resources together going forward, or back away, or look for other alternative approaches, that is what we'll do. And what I would ask this board to do for us as well, and I agree with you, kind of radical transparency and engagement here is utterly essential. But I would submit that it goes both ways. And what I would ask you all to do as board members engaging with us as staff is making sure as issues pop up, that is Ruth, I'm gonna keep going back to Ruth. Good Lord, Ruth, you were eloquent. What will look like failure to you all to start with, which was the initiation of some of this conversation over the last 2 or 3 weeks, when you get into it, provides a learning exercise for what is an element of success. And in this business of affordable housing, particularly the homelessness arena, the better we do, the more we make the job tougher going forward. Right, Ruth? That's a good way of paraphrasing what you said. And I think that as we go forward, then that means that we're going to have stresses that come up simply because we've worked our way down to that level. If I can use that as a right directional mode. And I would ask you all to engage with us in that regard too, because this is an arena where there is as a result of some structural issues throughout our society, been caused by a number of factors. It's going to take a number of actors engaged to bring about a solution. Do I think it can happen? Absolutely. Are we in the forefront of it? Yes, we are, along with our good partners like Father Joe's and Path and others. But it's going to be done in fits and starts. It's going to be done as we learn as we go. And I think that if you look where we are now versus we were about 6-7 years ago, we've got some good stuff done. And now we're getting down to the point where it's really going to get harder.
I can appreciate that. And the learning as we go, we're all just students of this entire cycle and this process. So thank you, Rick, fair point.
Let me also reverse that. What I would like to thank you all for on the board is your candor in this, and the fact that we've dealt with in a straightforward, straight up, no nonsense, very straightforward way. That helps us to an understanding expectations and making sure that the relationships are there. And I think is that straightforward candor between staff leadership and board leadership is going to make this work.
I agree very much. Thank you. I would like to just stay on that transition piece as we get closer to November and the handoff. And Lisa, to the extent that we learn anything, Lisa and Rick and Jeff, I suppose, to the extent that we're learning about the physical site going forward, I think it was an earlier communication where the commission staff had pointed out that we're learning about what sort of physical structures lean towards better successes because of the way that humans have to move to be near one another to respond to things. I just want to make sure that we see all of that in what comes back to us with the additional funds so that we can document the growth and the learning as we've experienced it. Because I think that the work is really impressive. So on a final note too, I think, and this is something that Commissioner Mitchell has, I almost said harped, Commissioner Mitchell has been so enthusiastic about bringing to the commission, and that's what are we going to do in winter? And I'd love to talk about that if we could in November, just to make sure that, again, into that full picture as we watch homelessness in our community, as we face it so regularly, that the commissioners feel very confident and that our housing authority is very confident in the scope of our outreach and our programming, prevention, and intervention. And then that does it for me on that item.
I think what we can easily do is show you what we can do as one partner in this process. The thing that I'm very careful about and to make sure that everybody understands is that there's no homelessness czar at the Housing Commission. This is not just ours to operate. We've been very high profile in how we talk about it, how we engage with the community, how we engage with the press. But there are a number of other actors, including the mayor's office, including the county, huge responsibilities over the county. So, ma'am, what we can very well do is talk with you about what our own part is and how we relate to other parts. And we can pull in other folks who are leaders in this arena as well, in particular the county and the city, the county for sure. But it's going to be a multi-pronged effort, and I would not want to think that the Housing Commission controls the whole thing. We're playing our part as we see it, as we can.
I have no issue with that. Commissioner Mitchell, did I represent your question well?
You represented it extremely well. And again, you heard the comment about that we should be we should be considered a victory that we're putting people in housing and giving them a roof and shelter. And some of them are unfortunately passing away, but at least they're passing away inside a room instead of on the streets. We need to have a plan for winter, or we will see people die on the streets. And, I just want to make sure, and I understand what Mr. Gentry said, but this is a collaborative. And so everybody
Yes.
needs to be involved.
Yes, sir. Yes, sir.
Thank you, everybody. I appreciate the thoroughness of that conversation. And again, thank you to the callers